World Health Organization officials doubled down on their commitment to fight the Ebola crisis in the Democratic Republic of the Congo. One America's Demille has more on how the agency plans to tackle the issue.
The World Health Organization provides new guidelines to tackling the ongoing Ebola outbreak in the Democratic Republic of Congo. On Tuesday, the WHO's Strategic Advisory Group of experts released recommendations on how health workers in the African nation can better treat the costly crisis. The list includes recommendations for speeding up the vaccination process, adjusting the administered dosage in order to conserve the amount of vaccines, and intensifying efforts to train healthcare officials in the region. Also included is a new experimental vaccine targeted at populations with a low risk of contracting Ebola. This, after the Congo's health ministry reported last week, the illness has claimed the lives of over 1,000 people since its re-emergence in the country last August. Exacerbating the problem is the dozens of rebel groups currently active in the Congo's northeast region, which has made it increasingly dangerous for healthcare workers to administer vaccines in certain areas.
Insecurity has become a major impediment to ensuring that we can access, engage with and serve the communities we wish to serve in Ebola control.
There have been attacks on over 80 healthcare workers since January. Last month, an epidemiologist was shot and killed, causing some healthcare workers to threaten going on strike indefinitely if another healthcare worker is attacked. However, WHO officials say they refuse to abandon the region.
We are absolutely determined to remain here, and I was very encouraged by the very clear commitment expressed by all our colleagues who are here to continue with this fight. So we will be here until this epidemic has been put to an end.
The WHO also faces a massive funding deficit, which officials fear will impede their efforts to support the embattled country.
As of today, we have received $34 million and have a current, urgent, critical financial gap of $54 million. And at the current time, we have reached critical levels in our contingency capacity to support the response.
Due to the increasingly uncertain circumstances, the WHO is unsure of when the epidemic will be contained. However, the chair of the organization's experts committee decided last month not to label the crisis as a global emergency, and that they were optimistic the outbreak can be contained in the near future. Demille, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.